Before checking the blood pressure, you will need to gather all necessary equipment. You will need a quality stethoscope, an appropriately sized blood pressure cuff, and a sphygmomanometer. To begin the blood pressure measurement, use a properly sized blood pressure cuff. Locate the brachial artery and position the blood pressure cuff so that the artery marker points to the brachial artery. Then wrap the cuff around the patient's upper arm with the cuff's lower edge 1 inch above the elbow pit. The head of the stethoscope, also known as the diaphragm, should be placed flat against the skin on the inside of your arm. The edge of the diaphragm should be just beneath the cuff, positioned over the brachial artery. Take the rubber bulb and tighten the valve. The valve needs to be closed completely before you start. This will ensure that no air escapes as you pump, which would produce an inaccurate reading. Rapidly pump the bulb to inflate the cuff. Keep pumping until the needle on the gauge reaches 180 millimeters of mercury. The pressure from the cuff will occlude a large artery in the bicep, temporarily cutting off blood flow. Then gently turn the valve on the bulb counterclockwise so that the air in the cuff is released steadily. Release air from the cuff at a moderate rate of 3 millimeters per second. Listen with the stethoscope and keep an eye on the gauge. The first knocking sound, or the quarter cough, is the subject's systolic pressure. When the knocking sound disappears, that is the diastolic pressure. The American Heart Association recommends taking a reading with both arms and averaging the readings. Once you have recorded your blood pressure, it is important to know what the numbers mean. Use the following guide for reference.